If your doctor has recommended a colonoscopy, you may have several questions. To better understand this process, it is important to know what to expect before, during, and after. Your colon, also known as the large intestine, is part of your digestive system. It is a long, hollow tube at the end of your digestive tract, where your body makes and stores stool. Many disorders affect the colon's ability to work properly. A colonoscopy is an exam that views the inside of the colon and rectum using a tool called a colonoscope. The colonoscope has a small camera attached to a flexible tube that can reach the length of the colon. During this examination, they search whether any condition is affecting the ability for your intestine to function properly.
Colonoscopy may be done for the following reasons: abdominal pain, change in bowel movements, or weight loss. Abnormal changes found on imaging studies, iron deficiency anemia or anemia due to blood loss, blood in the stool or black-colored stools, follow-up of a past finding such as polyps or colon cancer, inflammatory bowel disease such as Crohn's disease, colitis, or ulcerative colitis, and screening for colorectal cancer.
Your bowel needs to be completely empty and clean for the exam. A problem in your large intestine may be missed if your intestines are not cleaned out. Your healthcare provider will give you the steps for cleansing your bowel. This is called bowel preparation. Steps may include not eating solid foods the day before the test, staying on clear liquids starting the day before the procedure, taking laxatives. You need to drink plenty of clear liquids the day before the test. Examples of clear liquids are clear coffee or tea, fat-free bouillon or broth, gelatin, sports drinks without added color, strained fruit juices, water. You will likely be told to stop taking Plavix, Coumadin, or other blood-thinning medicines for several days before the test. Keep taking your other medicines unless your doctor tells you otherwise. You will need to stop taking iron pills or liquids a few days before the tests. Iron can make your stool dark black. This makes it harder for the doctor to view inside your bowel. Day of the procedure. Take your medications you normally take with a small sip of water. Stop taking clear liquids 3 hours before the procedure. Bring a guest driver for your appointment. When you arrive, please park in the designated area at the Day Surgery Center at Renaissance, located on Dove and Leonardo da Vinci. Arrive to medical facility 30 minutes to 1 hour before your appointment time. As you walk into the outpatient day surgery at Renaissance lobby, you will be greeted by the admitting staff. A laboratory for blood work and x-rays are available if the physician has ordered any before the procedure. At this time, you will be asked to sit at our lobby until called into the preoperative unit. During preoperative admitting, you will be taken to a private room where your vitals will be taken. All personal items should be given to a family member or to our security personnel. You will be asked to change into a gown, removing all undergarments. A registered nurse will ask admitting questions regarding your past and present medical history, medications taken, and surgeries. At this time, you will be asked to sign a consent, allowing the procedure to take place, and discharge instructions will be explained and a copy will be given prior to procedure. Once all the paperwork is signed and registered, the nurse will start an IV. During the procedure,
the medicines will make you sleepy so that you may not feel any discomfort or have any memory of the test. Colonoscopy is done most often in a procedure room at an outpatient department of a hospital or medical center. You will likely be given medicines into a vein or IV to help you relax. You should not feel any pain. You may be awake during the test and may be even able to speak. You will probably not remember anything. You lie on your left side with your knees bent. The colonoscope is gently inserted through the anus and is slowly advanced as far as the lowest part of the small intestine, examining the entire length of the colon. Carbon dioxide is insufflated through the scope to provide a better view, and suction may be used to remove fluid or stool. The doctor gets a better view as the scope is being withdrawn, so a more careful exam is done while the scope is being pulled back. Tissue samples or polyps may be removed using tiny tools inserted through the scope. Photos are usually taken using the camera at the end of the scope. If needed, additional interventions such as laser therapy may also be done.
After the procedure. After the exam, you may experience some bloating or abdominal discomfort and may pass a lot of gas. This will soon go away. You should be able to go home 1 hour after the test. You must plan to have someone take you home after the procedure because you will be dizzy and unable to drive. The providers will not let you leave until someone arrives to help you. At home. When you are home, drink plenty of liquids. Eat a healthy meal to restore your energy. You should be able to return to your regular activities the next day. Avoid driving, operating machinery, drinking alcohol, and making important decisions for at least 24 hours after the test.
When to call the doctor. If you experience rectal bleeding, abdominal pain, fever, nausea and vomiting, distension, or swelling of the abdomen.
Dr. Sospa Renaissance hopes that this information will be beneficial for you to have a prompt and safe recovery. For more information, please call 362-2015.
DHR Health Network.